The VDH update is the number of active cases in our health district. And in Covington City, there's a total of 624 cumulative cases since the count began. But as of today, there's only 24 active cases in the city of Covington. So there's not a lot of community transmission at the moment either. The school division is seeing very little transmission, and our community is seeing a trending downward. We also get a school metric each week, or every day we look at it, and we're not exactly sure where Covington, how we stand. We're still struggling to do what we need to do, but our numbers per 100,000 today was 1,062 per 100,000, 12.8 positivity rate, and we were seeing a downward trend in the number of cases that were actually becoming positive. So our data is trending downward. We're hoping that it will continue to trend downward and we can get at a level where we can not be worried about spread or how we participate with athletics and extracurricular activities. So it is the season of sports right now, and it's football, outdoor sport, and it's indoor volleyball, and then there's golf and cross country, and all of those teams have been practicing, and there is scheduled possibility of a game Monday for our football team. We heard from some folks last week. There are 19 football players right now on the team. Volleyball is having tryouts, so we don't know exactly how many how many girls will be on the varsity and the JV, but there's a large number. Golf, we have a small number of golfers, but they are very active golfers. And cross country has become a very, very popular sport in our community. So, Mr. Baker?
With those numbers that are in place now, and the information that we're getting, how are we trending? Where do you think we'll be in the next 6 days?
Today, Dr. Morrow, that we speak to weekly every Tuesday, said that we were trending downward very quickly in this part of the state. Allegheny around us is in the orange now. Bath County's in the orange. Highland County's in the orange. And Covington's right in the middle of Allegheny Highlands, and we're still surrounded by orange. So we feel like that orange around us does reflect the entire community, not just the city of Covington. So that area around us is in the orange.
But if we just adhere to the numbers, then you have the potential of not being able to play.
That is correct. That is correct if we follow the metrics that has been utilized up to this point in time. But the metrics have been not followed by many of our school divisions in that district. They have changed and are now actively participating. They did some winter sports, or basketball, and they're all still in the red right now, and they've also begun planning to play football games and other games like volleyball games all around us. Our ADs and our administration feel like we have been successful with our mitigation strategies in the school, and I think I speak for them and with them tonight that we believe that if a decision was made to let us play some sports, that we could safely mitigate those, how the games are played and how the players work together in pods to be safe. You heard last week from Ms. Hale that all of our football players have it's a mask on their helmet, plus they're wearing the face mask. That might change during the game. We're doing lots of things to provide safety mitigation for our teams. Our coaches are following the rules put down to them, and we feel like we are on the right path to consider playing in some sports.
So am I hearing you correctly that we should go ahead with sports?
I feel like just as we made the decision to do in-person learning, and we did all of those safety measures to be safe, I feel like, yes, now is the time to give us the opportunity to start trying to play in some contest. But
I want to make sure I was hearing you correctly, because if this comes to a vote, I want to make sure that we have the support of you and the ADs and the administration, that they feel comfortable with taking care of that, because that's a big undertaking.
it is a big undertaking, but just as the undertaking of 980 students, I don't know what that is, was also an undertaking, we followed through very well with that, and we are very fortunate that we have two athletic trainers on staff at Covington High School who are very, very conscious of all safety measures, and they have told the teams that if they see anything not being followed to the T, they will tell that team they need to stop and regroup and maybe not do what they want to do because they cannot follow the rules. It's not a change in our thinking process, it's a change in how we feel that now's the time to give us an opportunity to try the athletic contest. The outdoor sports are very, very outdoors, so you don't have that worry too much. The volleyball has always been coached by staff that believe in following the rules and how important it is to be safe and make sure your teams are ready to play and that you do follow all the safety mitigation. But yes, I think we would like to have that opportunity to try.
Well, in addition to everything that you said, Melinda, there's been a lot of discussion about how the impact of sports has an effect on the students' mental health, and how that's very important as well. And I've listened to Ms. Hale here several times. I have 100% confidence in her as far as moving forward and her overseeing everything. But with the mental health aspect, I think that's very, very important. Madness, as you know, like gravity, you just need a little push. And I think if we keep them from playing sports, that's the path that we'll go. And it's everyone I've talked to the last couple of weeks, parents, students, some staff, they, just like Mr. Smith in here last week, they're dedicated, they know how important it is, and it's part of that school experience for these kids. I, for one, believe we should move forward and allow them to play sports, whether that means we have to move away from the agreement, or I'm not sure how we would word it, but before somebody makes that motion or whatever, is there any discussion that anybody wants to have about it? Anybody feel different?
Well, could I just say one more thing? The understanding has to be there, whatever decision that's made, and if the decision is made to move forward, that number one, instruction is most important. And if we have like a sports team that would have some COVID quarantining, or we would have to shut down, so to speak, that particular team and regroup and start over again, and then we would like to have the opportunity that you all would let us make a decision that maybe we have to stop for a week because something's not good. This is not giving everyone that we're going to play 25 games. This is just giving us the opportunity to move forward and see if we can follow our hearts and do what's best for our students and provide safety mitigation strategies and see if we can make the play and contest happen.
And an example of that would be you have an upcoming game and you have, a quarantine or you have an issue or whatever, and because that particular incident, you would possibly have to shut down for a week. But then you would be able to continue if you mitigated everything, and there was and contact tracing was done or whatever had to happen. That's what you're suggesting.
That is exactly what I'm suggesting, is that we are given that opportunity to make those decisions if a team has to be quarantined, and I think our student athletes understand by now that if they want to continue to possibly play a game, that they have to listen to the coaches and the trainers and the ADs and the principals and do what's necessary to keep themselves safe and healthy. We're still doing the screening every day for student athletes as they walk to the practice field or they walk to the games. So we are very actively doing all those things that we should be doing to be successful. Hopefully.
Have you had a chance, Melinda, or anyone, to be able to compare and contrast that most recent CDC guideline sheet versus what we've been going by, which is the VDH guidance and dashboard? Seems to be, I have not been able to go over all of it, but it seems to be there's a fair bit of difference there. The CDC guidance gives us maybe a little bit more room to compete.
Yes. The CDC guidance, which just came out on Friday afternoon, is going to change the color coding system, is going to also give us a little bit more opportunity to look at the strategies that we are doing. And I do think we are going to hear more from the Virginia Department of Health in the coming days and weeks. We're going to hear more from the Virginia Department of Education about what this means, but I think it is concerning to everyone about the mental health of our all of our students. And this is just another opportunity for all our older students to move forward with the CDC guidance. They're still concerned. There's still evidence in there that 6-foot social distancing is important, mask wearing is important. All those things that we've been preaching since we opened schools on September 9th is still important in athletics as we move forward.
I will tell you that Allegheny approved for sports to go forward, and there was sense of, I don't know how I want to put it, a sense of happiness amongst the student athletes and even the kids who don't play sports. I think it was just like a moment of, oh wow, this might really be coming to an end sort of thing. Not that it is, but in their young minds, that's something that is a big part of their life, whether they play or watch sports. And I don't know, it's a hard decision. I said this to a friend this evening on the phone when she asked me if it came up tonight what I was going to vote, and I said it's just hard when you have someone else's life in your hands. You want to make the best possible decision you can, but hearing what you said, believing in our staff and our coaches, I think that we have got to do something to help our children feel like life, there's light at the end of the tunnel, so to speak.
Well, let's put a smile on that face then.
Melinda, without having the CDC guidance, I guess, in front of us this evening, how would you like us to just sort of delegate the authority to you and the rest of the administration? And then do you anticipate us reviewing and maybe sort of matching up what we've already got in place with the VDH dashboard, but maybe in the future with the CDC guidelines? It seems like that's where we're trending to, is that folks are saying, okay, the CDC guidelines allow us a framework, there's a clear structure here so that parents, students, everyone understands what may make us shift back or postpone or cancel again. Is that what you think?
Yes, I mean, just because you might give us permission to proceed with athletic contests does not mean we're going to pull back on all those safety mitigation strategies that are so important to keep our students and our athletes healthy, and our staff, our coaches. But yes, I am asking that you allow us tonight to consider putting a smile on the students' faces and trying athletic contests if the conditions are right. And the conditions must be right.
Can I just say,
Yeah.
I think we're going to vote on this. We need to also vote to add this to the agenda.
Okay.
Since it's not on the agenda, it wasn't advertised as being on the agenda. So I think if we're going to take action on something, we also need to vote to put that on the agenda.
So move to include the consideration of athletic contests in the agenda.
Cool.
I'll second that, if that was your
Will
motion.
you make
Yes.
that motion?
All those in favor? Any other discussion?
Melinda, I was just wondering, what are some of the safety mitigations you have for, I was just wondering.
Did you say volleyball?
Yes, ma'am.
They wear masks. When they practice, they're in pods. They stay with the pod when they're in a practice. They are not as physical as, they're not a contact sport like a football team, so you don't have that contact. When they practice, they stay 6 foot apart. All those things. Now, in a game, that might be a little bit different, but during practices, all those safety mitigation strategies are there 100% of the time. I've not seen a game this year, so I don't know what a game would look like in volleyball if you are doing all those things, but we are wearing masks and we will do all those things to keep everyone safe.
Well, just seeing it played before, volleyball as an indoor sport seems ideal when it comes to social distancing. Considering their location on the court, the teams aren't interacting other than volleying the ball back and forth. So I think it would be easy to apply those standards, especially to practice is easy, and then games it wouldn't be near as hard as long as you follow all those.
And I'd also like to say there are guidelines for the number of spectators that can be admitted per student. There's limits on outdoor. At a stadium, you can't have more than 250 people in the stands. Indoor sports, we have mitigation in that we're probably not going to let visiting teams come in to the volleyball. We're live streaming the events so that we don't have and we can't have a crowded room. So we're actually taking quite a few mitigation strategies to be safe.
Okay.
Eric?
Well, I concur with you all. We definitely, if you've been successful with the mitigation strategies in school, in-person learning, over 980 students, and the ADs feel that we can implement this, I definitely think our children should have a smile on their face implement this with the understanding that if something was to happen, like a outbreak or something like that, that we would have to step back, regroup, and then move forward. So I concur.
Any discussion on how the motion should be worded?
I think I mean, my question, I think Melinda cleared up. I mean, you intend to match up our athletic participation with current CDC guidelines. Is that okay?
With the understanding that we might have to make some changes as the community transmission could change or not change, and the in-school transmission changes, yes.
This would be something that you and the AD, yes, right?
Yes.
No one speak.
I'm not.
Yes, Erica,
I was just saying that this would be based on Ms. Snead-Johnson and the AD's decision.
A constant. It would be
Yeah.
a constant
Yeah.
oversight of it.
Okay. Well,
So the motion must include that.
well, I'll take a crack at it if you like, Cameron.
Go for it. Front away.
I move that we return our student athletes back to competition, allowing Ms. Snead-Johnson and her staff, in congruence with current CDC guidelines, to go forth and have our student athletes back on the field.
And I second that motion.
Good, we have a motion and a second. All those in favor? Aye. Anyone opposed? All right. Sports, baby.